That being said, I would like us to without transition, just talk about the challenge that the outpatient services represent for the health system in itself. It's like, as you said, people who have TB go to the hospital, receive treatments, and then just maybe disappear and don't follow their prescriptions or treatment the way they should, and then they come back, either with resistance or they contaminated some of their neighbors or family members. So how can we improve the quality of the service for the outpatient part of the system?
Yeah. Thank you. Apparently, the key aspect that lacks in our healthcare system is community-based interventions. When we focus on healthcare system, we are more focused on hospital-based for those that are sick. So most of the time, when people are sick, when they are discharged, they go home, there are no follow-up interventions that follow. Usually, if someone is sick, for example, after discharge of that particular patient, you write medications, you write a prescription without follow-up. Then the person will go to a pharmacy, and the pharmacist might be very busy. Or sometimes there is no pharmacy in some of these pharmacies to explain the prescription for that patient. So they will go, take their medication, and then at some point they will stop. Because there is no thorough explanation on how long they should continue. And someone with a condition like high blood pressure, they will come back. Maybe when they come now with complication. They just think the time they came to the hospital with a complication, that complication has been cured. But there are no follow-up interventions that we provide in our communities to explain to those people, to link them back to our outpatient setting so they can continue to get their services. And this is where entrepreneurship actually is vital. So people can have organizations that will say, oh, I'll work with this hospital, I'll work with this health facility. If you see a patient, you discharge the patient, our own responsibility is to see how we can get information from you on how you want this patient to be followed up, on how you want this patient to take medication. So we can now link the community with the healthcare facilities. But those are lacking. In other places, people are doing it, home visit. They say, oh, I have an organization that is responsible for home visit, that take patients from the time of discharge to the community, and then take that patient back to the hospital when it's needed. Those are areas that we can look at. But even the aspect of social entrepreneurship. In other countries, for example, TB has what they call community-based interventions. People can deliver anti-TB drugs, that's TB medication, directly to patients in their communities. So they take them, they make sure that they get their drugs. So if there are problems with transportation, you solve that problem by your intervention through social entrepreneurship. And people that are funding these programs might be happy if you are able to make a thorough assessment on how this one can provide interventions, impact. So we need to look into all these things. There are some other things that people are doing. If you look at implementation research, they give anti-malaria medications in community. For example, someone at Kubi who has a child that is sick, I just come to a particular center. They have rapid diagnostic test. Something you can just test. Oh, this is malaria. Take this medication. You prevent the mother from considering that should I go to the hospital? If I go to the hospital, this might cost me. Sits with that child at home until probably that child dies. You solve the problem. So we need to look at community-based interventions to prevent problems that occur in the hospital at outpatient setting. But there are also issues that occur even within the hospital setting. You know, the way we give appointment. Sometimes if you have, for example, a diabetic clinic, you have to go to call first thing in the morning, 7 a.m. All the patients are there. They will wait. Sometimes you see the last patient at 1 p.m. Someone has come from morning, 7 a.m. We don't give a staggered form of appointment. So that's a challenge. And our attitude, the way we actually talk to these people, drive them away. There are very key aspects on our own attitude and our own systems on how we handle them. But entrepreneurs can come in and see how they can work modalities with the hospital setting to see how staggered appointment can be made. So people can come, have the appropriate appointment schedule, take their services or obtain their services at appropriate time. If we don't do that, we are driving people from the hospital. That's why people don't come to the hospital sometimes. they prefer going to somewhere they can just stand at over the counter in pharmacies. That I'm having pain here, they say, oh, take this drugs because of this. So we need to look at it at different aspects, at community level for us to solve the issues of our patients, as well as at hospital settings.
Thank you so much, Doctor, for this very clear explanation. It's really very satisfactory for the patient or for the general population, because I think you have touched where it really hurts for the population. You also have mentioned twice the role of the pharmacist, and it's something that I would like Manal to jump on and please clarify what's the role of the pharmacist in the whole health ecosystem, please.
Before talking about that, I guess also because of shortage of healthcare professionals, that's why we're having overflowing or lots of overwhelming number of people seeking healthcare. So the role of a pharmacist is very diverse, and it's a lucrative profession, which I'll encourage all of you to, some of you will be interested to do it. Yes, so pharmacists are generally, historically, pharmacists are believed to be just drug dispensers. But now we're evolving out, and we've evolved from the traditional dispensing role to a more patient-oriented focus. So apart from ensuring that our country have good drugs, standard drugs of the right quality, of the right active ingredients, we're also involved in supply chain, of the supply chain, making sure that the right drugs come into the country for the right purpose at the right time. Also, that involves regulation, as we have the Pharmacy Board of Sierra Leone. Also, we have pharmacies that are involved in the industry in making these drugs that we all take. And pharmacists also play a very big role in education, health promotion. And we also have clinical pharmacists, which have a big role to play in the hospital. And that is one thing that is lacking in the country. Because in other developed countries, or where there are more pharmacy professionals, and where the pharmacy profession is more recognized, they have a very big role to play in the hospitals to prevent medication errors from prescriptions, drug interactions. They're there to monitor the patient's response to the drug that is prescribed. They're there to monitor adverse drug reactions to those drugs. They're also there to monitor prescriptions in terms of contraindications to these drugs. And also diet. Pharmacists also play a very big role in hospital when it comes to diet, because we have what we call as drug-food interaction. We also have drug-disease interaction. So that is where pharmacists come in. And also, pharmacists are responsible for dosing of medications, also especially when there's liver or kidney problems in the hospital setting and all the rest.
Thank you so much, Manal, for that clarification, because I think the clarification is very important, because yesterday somebody challenged me by saying, oh, this is a pharmacist, she's not a doctor. And I was like, sorry, because I can understand the general population being confused about the role of the pharmacist in the overall ecosystem of the health, because of course their role is not only to sell the drug, but all of what she just has explained. Thank you so much for that. You would like to ask?
Yes, I think I really think we have a problem in terms of human resource, but we also have a problem in terms of systems. There is now what they call differentiated service delivery. The way we treat patients in an equal way. Differentiated service delivery is trying to see how best developing nations like ours can utilize the available human resource to provide optimal services. Let's say, for example, I'm running an HIV clinic of about 4,000 patients. I don't treat all of them the same. There are some that are very much okay. They are stable, taking their medication well. I can use a system of drug delivery. Wherein I can say, oh, this person can be given drugs at community. That's what they call community delivery. At the time the person is okay. Some people, they want to come to the facility, but they're working. There's a lady at some point, so we say, I'm working from 7 a.m. to 7 p.m. I can't come for my drugs. So she only has time at 8. So those type of people, you can have a form of delivery service you give to them. And those who are sick, who require more attention, you cannot live with them when you know your healthcare service is a problem. So we really need to put some systems in place to make sure we solve the problem of the people, not at the expense of our own health as healthcare providers as well, but at the same time we have a bigger impact. As I think is very crucial.
It is. You would like to.
Yeah. I was listening to your question about outpatient service delivery. I think first of all we need to recognize the fact that our population has multiplied, and two, the types of health challenges we're having has become pretty much overwhelming for the size and capacity of our hospitals. It's perhaps is a bit overdue, but in terms of approach into the outpatient department, in progressive world or developing other developing countries, I'm not even going to say developed countries, I'm not even going to developed countries, at least those that are at least a couple of steps ahead of us, there's already a system of triage. Triage means when the patients come in, how you differentiate them and make sure you basically distribute the kind of issues that they're coming in with to help stabilize the efficiency, timely, in terms of effectiveness in us giving them the help they need. Like when you go into a hospital in England, if you come into the outpatient department, it is even overwhelming. And there is a tendency of you being there for hours. So don't believe that when you walk into an outpatient in Sierra Leone it's any different. The difference could be is when you come in and you're on the stretcher, you're meant to walk into an acute emergency department, which means your attention is given to you immediately. You don't have to be lying down on a stretcher for the next 4 or 5 hours. And also, in developed areas, there will be people, which I think it's about time we start diversifying the level of expertise of which we provide healthcare services. Dr. Lako was saying, we need people who are going to be trained in managing these outpatient sectors. So when someone comes in, someone could approach you even before you registering, waiting are you being complained? Go into the GI department, which means the gastrointestinal department. That already kind of shifts like the effort and weight at which we can provide our service to better improve effectiveness, timeliness, and obviously encourage more people to come into the outpatient department. Because I know our Ministry of Health is trying to do the best that they can, but I honestly believe, and trust me, I've been in the public sector, and this is part of the discussion we've had even before today, and it was part of the reason why I felt I could do more as a private sector individual. But the way health system is run in Africa, it is about time we start working towards improving the quality and accountability at which we work within the health department, both from the professional side and from the management side. Ministry of Health is doing a great work, but I think our health system has not thrived fast enough, developed enough for it to function better on its own. Perhaps it's about time we start working on handing over some of these management responsibility, both financially and practically, to individuals who are trained to manage this capacity on their own within the hospital itself. So we cannot be having laws being made that is not effectively being carried out within the hospital. And that is why we would struggle with saying, oh, we need a new department, and we need a separate emergency department for surgery, and we need a separate emergency department for internal medicine or GI or infectious disease. Because who's going to fund it? the hospital can perhaps find a way to collaborate. We might need to develop a pilot study, recruit some of the younger people in helping them get it, because that is already a job description for people out there. We have graduates who can start working on research, can basically start working on intervention in doing management and administrative roles as health within the health service industry. So in this capacity, it is also an opportunity for you to perhaps come together and ask for NGOs to perhaps start training you in these capacities as administrators or health service delivery specialists. It doesn't mean you have to be a pharmacist. It doesn't mean you have to be a doctor. It doesn't mean you have to even be a nurse. You just need to understand what we're looking for to help make the effect at which people are coming in is basically distributed so that we can carry out our work better. Also, look at when you walk into the hospital, the field around the area. These are places that at this point should not be the case. Yes, it's overwhelming, it's overpopulated, but it needs to be managed differently. And maybe I can voice myself out better than others, but I speak for the millions of people out there when they walk into a hospital and you're afraid to even ask because you don't know who to approach. There's minimal science available. People are not talking to you because this is another issue. When you walk into the hospital, the doctor is so overwhelmed that they're agitated half of the time. They don't want to even, yes, what to do? I mean, please. I know we're a piece of work sometimes. Bear with us. But maybe if you smile a little bit, we can always work in between. We're trying to improve the level at which we provide professionalism by mentoring the younger generation to have a different approach to dealing with our patients and trying to provide a level of specialty at which service is delivered, professionalism all at once will take a bit of effort. But this is something that even us as professionals need to work on, and we're guilty of it. I'm not saying any one individual. We're all guilty of it. And also, as the fact that I mentioned, Quality and Accountability Unit is a system that in developed countries is set to help make sure the policies that have been put in place. For instance, if you're meant to deliver your service into this level and that level, in this environment and that environment, these are the people who come around as workhorses to make sure it has been delivered and standards are being met. Because once that is being controlled and there's penalties to a certain extent dealt with when it's not being met, trust me, people will start marking up to that level. But if we're still working on the temperament of alpha do, we cannot move. There has to be responsibility taken for our actions, both even for ourselves as health professionals. It's understanding that we lack of the amount of health professions which we have in the system, but hence we cannot copy everything that is taking place in the outside countries or first world countries. We need to learn how to develop our own accountability and quality assurance for our own standard and slowly mark it up to international standards. But again, we need to start now.
Thank you so much. You know, there is something that I know that I'm very good at. It's like choosing my speakers. I know I can do that. Because, you know, the rest of my questions are dealt with by these great speakers. It's amazing, you know, it's their system, they know it as the palm of their hand, and this is just like inspiring and very satisfactory. I'm so happy to have you guys on stage. So you have talked about most of the things that I would like us to tackle, and one of them is the record management of the patients who come. For you to be able to know how to do the triage, you need to have the records for those people. So we talked about the record management system. How can we improve that management system for it to be premium? Yeah.
We live in a very digital world, And again, our population has maxed itself for the way at which we've been carrying out recording and information technology. I know there are books and files kept at every hospital from way back, but we're marginalized as to how much that helps us in continuity of delivering quality service for our patients. Hence, it is about time we're extinct in terms of getting to pace. We need to understand everybody's on social media, right?
Yeah.
Everybody's on WhatsApp. So why isn't the hospital on internet 24/7? And we're supposed to be the most, or perhaps let me not offend the other professions, we're supposed to be one of the most prestigious departments in which we deliver service for people. So it is about time that health systems do become digitalized. Yes, if we want to keep recording it manually, we can still do it because certain people are going to need some time to get abreast with information technology and setting up that network. But at least within each hospital or health facility, we need to make sure that there's access to adequate communication, information technology, data collecting, and that is where we also need you all to come in, get people involved in administrative courses that is tailored for health informatics. Because we have people who are doing it now, but because they do not know, for instance, what signs and symptoms mean, what specific areas mean, when we get them, it becomes very challenging to keep them intact and abreast in providing us the adequate information into that health system record keeping for us to be able to use that system the next time the patient comes in-house. Because as Dr. Lako says, if a patient comes in with PTB, tuberculosis, and they're recorded from outpatient, or let's say we've even had an outpatient that's just for TB that we do have, it doesn't mean that everybody's walking in there. They're still walking into the wrong place, right? So if somebody comes in and asks you, have you ever been here before? And they're like, yeah, what's your name? There has to be a way that locally we know it makes sense, either by thumb printing, recording our patients, so that any public health facility that you go into within Sierra Leone, as long as it's your thumb, it's like your voting right, basically. As long as you have that, it could be like part of your ID system. And once you have that, it will show, yes, you've been here before. If they brought you into an emergency department, let's say in the province, and you were unconscious, if we will have a system to just thumbprint you in, that's already identified. This person has diabetes. And this person is on insulin. So that's why perhaps he's passed out. And that's already stepping us up a huge lump, because otherwise that person could basically die. Because if that person passes out and then outpatient, and instead of giving them sugar to help revive them, you do the opposite. There's only two doors. One is in and the other one's out. Okay? But these are parts of health that involves us all, and these are ideas for you yourself as young entrepreneurs. You can jointly approach people who feel that they could be interested in these areas. You could be trained in various areas and do that alone. Research has got so much money. God, health research, and especially in Africa, has so much money now. There's so much funding for women, and also for men. Yeah, I'm not being biased. Trust me, I love the fact that we're encouraging our women, but I think we need to make sure men are also following up drastically, because we need strong men around too, right? So we need a collaborative effort at which we appreciate the value at which we need to run fast. We're like 20 years behind, but if we aim at least at catching 10 years ahead now, maybe in another 5 years after that, we will be at par with the rest of the world.
I do believe that bridging the digital gap is going to help us bridge these 20 years. Like, it may seem very huge, but if we use social media and technology appropriately instead of just like invading it with our daily life, then it would be something that we can fast track in 5 or 10 years later.
If you don't mind, there's another thing that, okay, I'm here, but it's not very coming from me as a doctor, but your feedback is very necessary. There are times that I know people leave health facility and they want to vent out. It's highly necessary that we share our feedback about your experience that you've had, but also for us to progress, we need to learn to do this rather positively. I've been indirectly perhaps impacted more so with negative feedback about places which I work, and because they know I'm affiliated with it. And there's so much more that could have been done in advance to prevent it if some of these feedback come. And as Sierra Leoneans, we also need to learn to accept these feedback for us to know how to grow. Okay? We need to understand criticism is both a good thing and a bad thing. If you learn to put it across in a positive manner, maybe sometimes just write it in, anonymously slip it in somewhere, direct it somewhere. It could make such an impact, not just bombard people, hey, this hospital, don't kill that person there. You know, that has two ways, because if we run and start closing all these hospitals that you believe killed somebody, where are you going to go? Where are these doctors going to help you? First of all, we know that you wrote it after that. So it's already building that gap between our relationship, which our community is so small, we all know each other, honestly. So a positive mindset in inspiring change as Sierra Leoneans is so important now. You have social media, use it rather positively. I'm not saying pamper people and just go tapping people on their back. Give them both positive and negative feedback. I went there, I like this about this, but I think you can change about that. Instead of, it's something as young adults, we need to see why it's not changed or why it's still negatively accepted.
Yeah. Thank you so much, Dr. Effie. Like, as patients, really, we relate to what you just have gone through. It's so frustrating for us to just like be lining up in the waiting rooms for hours just for your file to be found. I'm sure you will agree with me. And that is like both public and private sector. And it's so beautiful to hear somebody who's part of the system, who's acknowledging it, but not only, who's also giving us like tips on how to improve that. We'll come back to that, to the frustrations of the patients and how to deal with it, how to give solutions to it. But meanwhile, I would like to give the floor to Regina for a short break and we visit the stand we have today.
Good afternoon. I'm here to talk about Wangu Organic Farms. You know, as the name implies, Wangu is an agricultural company. We basically growing fruits and some vegetables. You know, like we started with passion fruits way back in 2014 at Weekend, but I would extended it to number 9, Solo, and then at Kenima as well. It's a fruit. I know a lot of you guys here don't know about passion fruits. Maybe some of you might have known about it or read about it as well. But it's a tropical fruit that has a lot of medical benefits, and we processing it to juices. At first, we've been processing only passion fruits and selling the juices as well. But a lot of our colleagues, other people in our own country have been demanding for some of our own local fruits as well, like tamarind, pineapple, watermelon, and a lot more. So we're doing them as well. So we try to extend our farms as well, like growing passion fruits, watermelon, and tamarind, because we want to do our own fruits because we're growing them organically. So in that case, we're also doing mushrooms about 2 months more. So we started doing mushrooms supported by the FAO. And then we're doing them at 4 Mile Agricultural Compound. We've started selling them as well at 30,000 for 250 grams. So yeah, we're selling them as well. So we're basically doing agricultural stuff, making juices, growing passion fruits, growing other foods, and some other vegetables. All what we're doing is organic. And then we're processing organic soils as well for people out there who will be buying soil with no chemicals. And then we've been doing them as examples. We've supplied like the German embassy. We've decorated their whole compound with our soil and some flowers as well. So that's what we're doing, and we're doing it fantastic. And then the juices are here. We're displaying them and we're selling as well. This is a cup of it. It's 10,000 organic, organically grown juices. Foods and processed locally. No sugar is added or other ingredients. Yeah, just the juice itself, and then you have it here for 10,000 euros. It's really good, and it has a lot of medical benefits. I think if I'm here today, that's why I'm here, and I thank you all for audience.
Thank you so much. Thank you, our vendor today. Thank you for these great nutritional food and products that you have for us.
I want to commend you for all what you're doing, but I only have one concern about the mushroom.
Okay.
You know, sometimes you have to have someone that is an expert to check whether it causes any poisoning or not, because we have mushroom poisoning that can actually affect your body.
And this is why we have the FU supervising.
Okay.
Yeah.
Thank you so much.
Yeah.
Thank you. Okay, so because our speakers are so good, they have gone over the audit and quality management part of the system, which really needs to be improved, because the system, as we have seen, is challenged in many ways. So how can it be improved in terms of the auditing and quality management? You also have tackled the partnerships, the importance of partnership and collaboration, which we really would have loved to dive deeper into, but due to time management, we would like to just get it to you with another question so that you can answer the questions both at the same time. So the question I would like us now to tackle is the maternal and neonatal mortality, the rate at which mothers and people under 5 are dying, like young children. So how can we deal with that? What are the causes of the maternal death? And also, how can we give solutions to that? Dr. Lako, would you like to start?
As we all know, for example, Sierra Leone has the largest maternal and child mortality in the world. And part of the Sustainable Development Goal is for us to reach a target in which child mortality is reduced to 25 per 100,000 child, 10,000 child life birth. And also for neonatal mortality to reduce to 12 per 10,000 live birth. So we are far ahead to reach that, and it's really, really sad. And some of the reasons why we have that high mortality rate is definitely just because this health system is not strengthened enough to tackle each and every stage of development during pregnancy, from preconception, or from among women that do not want to give birth, they are not ready, to those that are ready, that are already pregnant, to the stage where there's childbirth, and also neonatal care. So there are lots of challenges in each and every steps involved. So, for example, measures that can be taken at preconception stage is we have to put measures in place where the nutritionist is there to, for example, advise on the type of food that you can have, and also health specialists or trained midwives that will advise on the right vitamins to be taken for you to have a healthy fertility, to have a child, or preventive measures for example, conception and contraceptive measures is very important, and post-abortion measures also is very important. So at the pregnancy level, there should be skilled health workers that will actually have the time to dedicate to these women as to what pregnancy is all about, what is needed for them to eat, to provide quality food for intrauterine development of the baby, not to have low birth weight, to have the appropriate, even the weight of the mother is very important to prevent non-communicable diseases. Also, to make sure that the mother has the right vitamins she takes to prevent anemia, and also other complications that might arise, and for the mother to be offered with the right vaccines to prevent generally complications. And also home care, also the community plays a very big role. Culture comes in, which also is very important. To advise mothers about self-care, nutrition, and the importance of exclusive breastfeeding. So exclusive breastfeeding is very, very important to prevent child mortality, because the breast milk has amazing components that will even prevent diseases during even adulthood. So from the pregnancy stage, you go ahead to tackle the childbirth stage, where the supportive care should be there, the medications or pain relief medication should be there, the right skill to diagnose labor, the right skill to be able to actually treat, for example, third stage labor, which is the main contributor to postpartum hemorrhage, which is the biggest killer or the biggest cause of maternal death in Sierra Leone. So we move ahead from the childbirth stage, then we go to the neonatal stage, or the stage where you take care of the mother also after birth. Definitely you have to have the right skilled midwife to be able to, for example, detect complications that might arise after childbirth, and to make sure that the baby is doing well, the breathing is okay, the weight is okay of the baby, infections, also giving the right vaccines, or advising on the importance of adhering to the vaccine schedule to prevent subsequent diseases. So I'll say there are different stages that needs to be tackled with the right skilled health workforce, and also the community plays a very big role.
Thank you so much, Dr. Mana. Yes, I would like you to add something if you will, but I also would like us to talk about the question about remotely located hospitals. Like, we are here in Freetown and we are having challenges. You as practitioners, you're having challenges with the health system. But when it comes to those people in the very remotely located hospitals and areas, are they, those doctors and practitioners, are they equipped enough to be able to give like a prescription that is up to the standards, the international standards, and also even the use of antibiotics? Because even in the city, people are just having challenges with the prescription of antibiotics. So how is it with the provinces and the very remotely situated areas?
You want to hear?
Ladies first.
All right. Well, you see, with the question as maternal and infant or child mortality, it's a very serious criteria for us to embrace, mainly from the public health sector. One, because when we're talking about the numbers that we're calculating in terms of percentages of death per annum, we need to find out which facilities are counting out these numbers. Also, do we really have enough correct, adequate documentation as to what has been the cause of it from the smaller community, as we would say, tertiary and primary care health facilities as a whole, or is it more generic? So basically the data which we've been collecting, we need to strengthen the quality of which these data has been collected for us to understand how exactly, areas exactly which are more severely affected. And is there a specific public health related issue to that community, like most of these children coming, let's say, from the slums, and we understand what the issues are, but what is this concurrence of specific illness that is causing? At what stage are these pregnancy being terminated, or are we losing the mothers before birth? What exactly is the cause? Perhaps instead of us waiting for them to come into the hospital, we might need to start developing a health structure within those communities. So I cannot emphasize enough the importance of data collection, statistics, for us to meet abreast with what we need to know and how best to approach solving these issues. That's one. Two, yes, the quality at which service is being distributed is also an issue, because lack of resources. We could have very good health practitioner and health workers in these communities, but if they're not getting the correct medication on time, if they're not having adequate, like for instance, blood banks, if we don't have blood bank in every district at this point, then the miracle is not there, basically. I'm sorry. You know, we're seeing our neighboring country doing the drone delivery system. I think we tried to launch one. Yes, President has done tremendously well in bringing that home. I don't know how effective and how operational it is yet, but that was so encouraging for me to see already. But besides that, when we talk about management of these issues, some of the things I believe, as small as Sierra Leone is, we could already do now, is develop a follow-up health system when you basically reach childbearing age in certain community. The community, if we have a system when we're recording how many girls we have there, can already start at an early age. If you're getting married or you're childbearing age, they start welcoming you early and start educating you, both boys and girls, as to how to go about being a responsible adult. Because don't forget, some of these places don't even have schools. You know, so we need to tackle it from that perspective. Also, even within Freetown, we have a lot of patients who, they get pregnant. They perhaps don't even make it to an outpatient anytime before they're near a delivery point. I mean, where were they all this time? Where's the family? And who basically reaches out to them? But everything becomes, it wasn't my problem. No, it is all our problem. So if you know somebody who you feel that does not have the understanding of going into a health facility, you perhaps might be like, you know what, let me take you to one and, you know, encourage them. That's from an individual effort. But what has helped a lot of developing, I try to make it separate because I know where we are and I know at least where we can get to. If we don't aspire to follow the good examples, it's going to be more challenging. Those of the developing communities have health service practitioners, as I said. They don't need to be doctors, they don't need to be nurses, all right? They just need to be in capacity of public health specialists, but also trained in administration, that basically go to this community, and if you're registered along a specific community, go to approach you to see how your environment is, and talk to you about, maybe the group will rotate. Sometimes it could be nutritionists who are in training, have this opportunity of accessing these areas and having one-on-one communication with a group of women, let's say within 3 or 4 streets that makes a community. Also, antenatal clubs. This should be a fun way of engaging young or pregnant women, all right? You have categories of women who are in their 40s in community and they don't know that it's dangerous for them to get pregnant after they're 40. And that's how they end up making it to a health facility when it's too late, or they deliver at the house, and when a disaster comes out of it, nobody can even give a record of what happened. because nobody knew about their situation in the start. So it's highly essential to develop these antenatal clubs that if you're pregnant and you want support from the government, it should be met at a compulsory level, that you need to attend at least 2, if not all 3, of these antenatal facilities. If you cannot attend these antenatal clubs, you need to give a reason why. Maybe they're challenged physically and they cannot make it to the facility, because in that case,
another solution is
exactly. Then in that case, the government can provide an opportunity to reach you at the house setting or bring you to the hospital.
Right.
That can take so much weight off us, because
house partition.
yes, because and also would save us a lot of money in putting effort into developing strategies to basically stabilize the effort of health service delivery has been taking place at the hospital. Because when this is done, we always say what prevention is better than cure, right?
Yeah.
If these issues are figured out earlier, you've prevented perhaps 80% of the issue that can take place afterwards. And that alone, in 2 to 3 years, if implemented now, we would see that statistics change. I can promise you.
Thank you so much, Dr. Essie. Can we just conclude with the remotely situated hospitals and facilities and the readiness of those doctors, of those practitioners, before we go to the question and answer session?
Actually, I will tell you the mortality. Mortality is there. At the end of the day, we don't want to do it. So the aspect of infant or mother mortality until pregnant women should not die when they are in pregnancy, when they are the broadly speaking, people categorize those factors that affect maternal mortality, child mortality, or maybe infant mortality into 3 lanes. There is what they call delay in taking delay in reaching the hospital, and delay in providing services. So the delay in taking it has to be with her. If I'm a woman, I'm in a remote facility, I'm not educated, and something happens to me, my husband is not around, I may not take a decision to go to the hospital. And similarly, if it happens to a child, I may not take the child, but the husband might not be in a communication reach. So I may wait for the husband to come back, maybe a day or in the evening hours. So that's one key aspect. But when also you consider the surrounding, where the hospitals are located, the road network, someone is pregnant, is in pain, how can that person reach that facility? A very remote setting. Then you realize that sometimes it's not out of their will, but the difficulty in them reaching those facilities. The Ministry of Health has a program that will say, oh, they are going to situate health facilities in a 5-mile radius. But if you look at it this way, even within that 5-mile radius, the road network is not fantastic. And sometimes when you think about what is going to happen in the health facility, if I go there, the attitude of us healthcare providers, if I go there, the problem of payment, if I go there, the drugs might not be available. So all those stuff make them sometimes not to take a decision to go to those facilities. But they prefer maybe to go to a traditional birth attendant who is just in the same village. So that's one aspect of remote healthcare service delivery. But thereafter, when people reach the health facilities, so many local and systemic factors are disturbing. We talk about the aspect of records. I've been there before, you come now. There is no records. And you know you need that information to follow up someone. If you don't have records, then it's difficult for you to say, oh, this is what we have done for you. Or maybe because we have a healthcare system in which records are verticalized, maybe they are just in this facility. Now this person has traveled to another facility. So when you go there, they don't know what has happened, whether the person has HIV during pregnancy, to see how they can prevent the child from having it. Hepatitis has been done and they need to do something, or whether they have done something like urine test that shows that there is a bacteria there. The information is not connected. This is where entrepreneurship is required, where you can say, oh, I can take a particular children or a particular section within the children and the facilities that are there, I want to work on connecting their health records. So that's if I align, somehow we just click. with the digital system and say, oh yes, this person has been in this facility and this is what has been done, the immunization services that these people have gotten. Well, I think the aspect here is the aspect of also education. It's disturbing all this stuff. Education of the patient and education of the service providers. Because we don't have facilities that provide training for health workers. In other institutions, in other countries, there are schools that provide training for health information management system. But here, in fact, even career path. What are we doing about it? We don't have a career path. And we can't talk about research when we don't have health record. We can't talk about proper longitudinal monitoring of patients when we don't have proper health record. So it's a potential source for us to see how we can explore those areas. But you know, the aspects of the medical science that is affecting us, some of it is actually systemic. For example, people are saying that most women in this part of the world are already nutritionally deficient, as Manal was trying to say. And if that is the case, what usually happens is pregnancy wasn't the problem. Because in pregnancy, the rate at which we need energy, the rate at which the baby also needs energy increases. So the aspect of supplementation, there was a time an organization was asking people that can help some communities to provide supplementations like folic acid, iron tablet, to prevent loss of blood, to prevent children from being born very small or being delivered prematurely. So those are all interventions that we can provide. But on the aspect of remote facility, it's actually very difficult to practice.
Can we just go over it very shortly because of time management and also I'm sure the questions and answers.
Yes, I'll just summarize. So in remote facilities, because of unavailability of services, laboratory, for example, there's an aspect when she was talking about blood services, support system, imaging, that's X-rays, ultrasound. Sometimes most of it is just empiric treatment that people give. Empiric in the sense, this what happens, so let me give you this. So that actually has the tendency to create problems with medications that might be misused. And as a result of that, they create what they call resistance. If you are given medication inappropriately, like this antibiotic, you create what they call resistance. And that has now been shown to be a problem. And if you don't do something, just take antibiotics like that, some people don't go to a facility where they have common cold. As a result of that, they may create resistance. Those medications, when you need them now, they might not work.
Thank you so much, Doctor. We will jump on that later during the question and answer session when you were answering some of the questions. So back to you, Regina, for the question and answer session.
Okay, so a lot of you sent me your papers, and whilst we do appreciate that, time has been well spent, so we'll just take a few of them. However, I would like to encourage you guys to please network. Also, after the event, the speakers will be around for a few minutes, so if you can capture their attention, that'll be great. So we'll take the first one here. Okay, so this one is from Mohammed Mansari. He says to all the doctors, we are seeing people going out of the country for medical checkup or attention. Can you think that it is a threat to a medical system in Sierra Leone? Or don't you think it is a threat to a medical system in Sierra Leone? So this is from Samuel J. Moore. This is actually going to Dr. Lako. He says, with these patients in Ghana, why do you have private wards in government hospitals? So this is from William C. Taylor. He's asking, on the scale of 1 to 10, how can you rate our medical system? Also, in summary, what 2 mechanisms can we put in place to curtail the surge in our medical system? All right, so that's okay. Like I said, they'll be here for a few minutes, so if you can grab their attention, that'll be great.
Thank you, Regina. Thank you so much. Yes, so please, doctors, we would like you to enlighten the audience on those questions. Please.
Let me try with Mohammed Mansuri's question. Who's Mohammed Mansuri? Hi. Medical checkups and attention. In terms of what could be done to improve medical system in general, a lot. We are doing tremendously well, one of which I think myself and perhaps Dr. Lako does most by mentoring our younger colleagues who are finishing, to encourage them to go specialize as soon as possible in diverse areas in health. I am very passionate about developing newer, trendy health system, but also in creating that environment that makes it appealing for people to be happy to go, instead of buy a ticket to go overseas, but to want to come into our own facilities here. Quite frankly, that would only be a better approach from the public health, from the private sector, because the public sector has its own challenges that it needs to basically resolve before that to become a bigger issue or priority for them. Which means some of us try to provide, if not even an in-depth option or quality in enhancing certain areas little by little. So that's why some of us will go do certain courses and perhaps specialize in niche markets, which is something I'm very passionate about, because I realized for Sierra Leone to thrive, I was in the government sector, and while I was there, the reality was this: I would go to work energized every day, and by the end of the day, perhaps my salary that was not even enough to buy my fuel would end up going back to the patient. So I realized, realistically, how would I change? How would I help improve the health system in the long run? And for me to be able to do that, I also need to understand that it needs to be developed both ways. So that's why you probably would have to accept the fact that many of us are trying to do it both from the government, and that's why some of us, even though we're not fully employed at the government facility, we do our service to public in various ways, like me working at the Leone clinic facility. So we see a diverse range of people and learning how best we can engage those who are traveling here by creating a space that is both welcoming for them, because if they don't come in with that money, that's why we need foreign investment. We need the locals who can afford to have better businesses. We need younger people to have better jobs and better economic development, so that they would want to go into this facility. Also, for those people who go overseas, to have confidence that the service which we're providing for them meets international standard. Because if somebody has the money, they're not compelled to come to me. I have to make it interesting, encouraging, and lucrative enough for them to see it worthwhile. Because that relationship could either be a one-time hit and miss, or you hit it and that person trusts you and for life, meaning that families for generations will come to you. So many of us try to provide, I believe Dr. Lako is just that kind of specialist in his own way, that believe professionalism, quality in our service is very, very necessary. Before we start building these space of, what do you call it, state-of-the-art facilities, we need to even start maintaining the little ones that we have to that level. You know, so maintaining clean environment and encourage people who we work with to practice on that same line.
Thank you so much, Dr. Essie. Since we have 3 speakers and 3 questions, I would like Dr. Lako to tackle one of them, and we give the mic to Dr. Mala.
The aspect of private facility within the government system, I think someone mentioned that. Certainly, it is sometimes needed, and this is actually what is not robust in tertiary hospitals. In other countries, they develop private facilities within the government institutions, and they are well furnished, provided some aspect of services that befit the money that the person is going to pay. One, it has a value in terms of generating resources for the hospital to take care of the poor. And it also encourages practitioners to stay within that hospital. Let's assume Connaught Hospital has a robust private facility. There is no need for me to move to a private facility to see my patient who prefer private services. There are people like that. They just prefer private services and they have the resources for that. But as long as it's legalized, it goes through proper systems. It's not for corruption purposes. It's actually something that can be utilized to maintain the hospital. I don't think it has any problem. I just want to make a quick comment on the aspect of seeking medical attention out. I think it's a concern. But I must say that we are trying. The government is trying. Because before now, you don't talk about people like us, endoscopists. But now we have endoscopy services here. Except if you feel like just going out to go and do endoscopy services. But now if you want to get those services, to look at your gut, then you can get them here. Now we are talking about doctors of pharmacy. We are talking about how pharmacy can be expanded. So even though we are slow in terms of how our population is expanding, and even though we are slow in terms of how other countries have developed, I'm sure if actually we look at this trajectory of improving our services, we don't lapse at some point, we can do better. But for now, the human resource is not completely available. If they give a breakdown of the specialties that are available in this country, then you know that it's not completely available. But also there is an aspect of lack of confidence in the system. Some people, whatever you say, they want to go. And sometimes they go and they tell them the same thing, they come back. To say, oh, that is what they said. You have to continue to take care of them according to the Hippocratic Law.
Yes, doctor. I'm a patient many times. I've been a patient many times in these facilities. And I do think it's not just like we want to go overboard. The lack of confidence, I think, is something that, as Dr. Essie said, is something you experience. And if it fails once, you know, most of the time you were just like, oh my God, the way they treated me last time. So as you said, it needs to be something, since we are walking on the straight path, we just need to continue doing it and also fast-tracking the evolution, because it's not something, I think, that is ideal to just stay where we are and not challenging the status quo, which you guys are not doing, definitely. So can I have your answer to
someone asked about how can you rate the medical system and 2 mechanisms to put in place to mitigate this. Who asked that question? Yeah, so as far as I'm concerned, I'll not fool myself or fool anybody else. The health system in Sierra Leone is poor. So I'll say I want to throw light on something that WHO spoke about, which is universal health coverage. It is said that everybody has the right to have quality health service as to when and where they need it. And in Sierra Leone or in the lower middle income country, we have health inequity, definitely, and it's unfair to all of us in the country. So I go back to talk about the shortage of healthcare workers. We have a big shortage of skilled healthcare workers, because if we do have a large number of them, most of these problems will be solved. So according to WHO again, by 2030 there's going to be up to 100 million people paying out of their pocket for health services, which will drive them to extreme poverty, which will further make the system worse. So also, according to WHO, we have 14,000 healthcare workforce shortage. So I guess if we can tackle that, we can help in mitigating this situation by doing that. Also, by definitely reducing health inequity, improving the infrastructure of our health system, and improving accessibility, which is very, very important, as Dr. Lako said.
Thank you so much, Dr.
There's one question someone asked about community-based interventions that are needed to tackle adolescent pregnancy, teenage pregnancy. Maybe that's what the person is referring to. I think for us, now there is an aspect of focus on women, especially for you that women. You can start by looking at how you can establish organizations that are looking at this. Now, it goes with maybe 2 interventions, service delivery and education. You can take certain communities and see how you can bring the services. And the condom use in this country is very low. It's about 34%. And the rate at which people that actually need to use it. And there was a time, the HIV program got to look like a video. Sometimes it expires. People are not using it. So these are all things that you socially market to make sure that people use money consistently and at all. But the other aspect is you can also educate people. Is to use other forms of contraception. It's necessary. That's the way to prevent pregnancy and the cycle of pregnancy, which we have. Because if you are getting pregnant at an early age, you might not be able to go back to the school that will help you to go to university. At the end of the day, what will happen is you give back to the children that you might not be able to take care of, and the cycle will continue like that. So these are potential areas for entrepreneurship in Jordan.
Yeah, I think another thing, as you all say, I happen to be fortunate being the founder and administrator of the Medical Forum for Doctors and Nurses. And that was something that I think Alex and the community set that up during the whole of realizing part of the issue towards our colleagues getting infected was through touch and interaction. So I figured out what can I do to get that problem solved so at least we can safely communicate. So we created and collectively my colleagues were so supportive. And up to today, we've used it to enhance our knowledge about what we all do. That's one. So I network as we have managed through that to basically draw in more of our colleagues within the diaspora, and they become more and more engaged. So some of them have started coming back even as individuals, giving back either 2 weeks, 3 weeks, even in group sessions, in trying to improve the quality of healthcare service delivery in education as well, towards improving the health and lives of Sierra Leoneans. And I don't think just in Freetown, in the provinces. So I think that has been a huge level of awareness as to how much we needed them, because that has helped a lot. And since they've been coming back, a lot of them are interested in giving more and more of their hands on. So we need to be realistic. For as much as Africa is small, certain movement certain progress to take place, we need to make investments. For you to have good quality of health service, it takes investment, and if when those investments are put in place, the people who invested cannot pay back, then it doesn't help. So when we go and we tell people, oh, this is expensive, that is expensive, the result of that is why healthcare facilities do not thrive, and that's why they go into quick foreclosure. Now, when we are asking for our colleagues, and trust me, Sierra Leoneans in the diaspora, we have some of the most highly qualified health professionals who are standing at the highest platforms in hospitals all over the world. I've seen them, I've met them, I've seen some of the facilities at which they function at. They're just waiting for an opportunity to come and give back. But it means we have to be realistic about the sacrifices that they're taking as well. So at that level, we need a public-private partnership where we can encourage them perhaps by providing accommodation, transportation, at which they can come and perhaps spend like a quarter or 3 months, 6 months here to help enhance the service delivery or teaching facilities at which we need so much to help improve locally. Because we cannot afford to send our colleagues away for a few years, and that is lack of our manpower as well.
Thank you so much for that. Thank you to all of you guys, ladies and gentlemen. And I'm so happy you landed today because you mentioned the diaspora and you mentioned how skilled and talented they are. But I do think they are talented and skilled in a place where they are not needed. They are needed in Africa. They are needed in here. It's here we have those challenges. If they leave America or UK or anywhere of the developed countries, they won't be missed. But we need them here. So we are also calling them to come back home without an invitation letter because they have seen the drastic situation their colleagues are dealing with, and the population is also really very tested. So we are calling those big brains who are equipped to come back home and please invest. Because of course, as you say, here, the youth that can invest here are not needed just to be like health practitioners. It can't be somebody who's very good at administration, management, or you name any sector that they're good at, and they identify the gaps that were given to us throughout this very deep conversation and just invest in it. Because what I have realized is the money is not the problem. It's not the money that is the problem. It's identifying the gap, researching on it, and also being able to implement the project or the proposal that you have submitted to those donors. So the invitation is for all of us to get our hands dirty and to help the health system, help the government, help all the actors in the ecosystem be able to thrive and to bring about a better health system in Sierra Leone. And I'm really very happy to have these people here. I do think that if you give me 50 of these young people, we will be able to definitely heal the health system in Sierra Leone. So thank you so much for your attention, thank you for your presence, and I give you another appointment, another rendezvous for the next edition in February. Thank you so much.